Hello, my name is Michael Zillerschlag and I am the CEO and founder of Leviticus Cardio. You know, you cannot live without your heart. Patients that their heart stop beating die immediately, and up to several years ago, even patients that are about to lose their heart die because they don't have any solution. But in the last 15 years, they have a device called VAD or LVAD that it's actually a small pump that can be implanted inside the body, inside the hole, connected to the heart of the patient. And this device can keep a patient alive for 5 years, even 10 years. So this is great and very interesting achievement of humankind, that people can survive and live with this kind of pump for several years and walk around. But they have a small problem. The problem is that this device connects to a wire that gets out of the body and connect to a controller and batteries. And we all understand that no one wants to be connected to a wire, to be restricted. No one wants to be infected. People that have this kind of device are chronic patients. They cannot swim, they cannot shower regularly, just like you and me. So this is not a quality of life, not a good solution. So just by physically, but also if you think about the economic side of that, you can see that many governments and many physicians restrict from sending the patient or allowing or finance patient to use this life support device, this life-saving device, because they see that as an awful solution, a very restricted solution, and they prefer not to pay money for that. What we change in Leviticus, we focus on this problem only and allow the companies that are doing this LVAD to have a wireless solution. We deliver the energy wirelessly into the body and support the pump of the main companies that are fighting in this area and deliver it and operate it for daily use. If I want to just give an elevator pitch in one sentence, what's unique to our solution, what makes our solution the ones that actually survive and is compete on operating the VAD, is our unique approach. We take it to the extreme for two ways. One, we said once the patient use our solution and use the implant part, he works just like you and me. You're not going to see anything about him. He just can swim, he can do whatever he wants. The only restrictions that he's going to have is a watch that tell him how much time he left till he needs to be charged again. Then, when he get and connect to our system, you can see we have a very robust system that sends all around the patient and make sure that he's connected, which is a weak point of wireless. We wanted to make sure that when we charge the patient, is 100% connect and safe. So this extreme two-way approach is appealing to the VAD vendors and make it the very interesting solution for them. To understand how the problem affects the market, you can see the penetration. The need is huge. Actually, the need that I describe here is only the most critical dying patients. That the only solution for them is having a VAD or die. And still, from all the number of the patients that could have by the insurance, by all the capability of them, have the solution, only less than 10% get it because the doctor don't send them. The medical center decide not to use it. And mainly because it's not good enough solution. They see that as a still missing part. And at least the VAD partners, the VAD manufacturer believes that the wireless is the one who missing that's going to make it happen and make the penetration happen. Just to say a few words about our position. We have a full operating system. Our system was working in animals and in cadavers for long term. We have a regulatory pass that allow us to sell our part already to the VAD vendors. We have strong IP portfolio, including granted patent in USA, 8 granted patents. And just if you can see, just this ship, for instance, was walking around 45 days with our system, no cable connection, nothing, just charge and recharge. Very interesting what happened in the market. Just a year ago, it was an anonymous market with no big player. It was hardware, was a small company, and the competitor was called Toratec. I'm sure no one of you heard about this company before. But a year ago, St. Jude Medical bought Toratec. Just a week ago, Medtronic bought hardware, and this is very burning, very hot market today, because as is expected, if you Google that, you can see everyone expects it's going to be kind of similar to what happened to pacemaker 2 decades ago. So what in the summarize, this market is burning, is changing now. We have a technology that is needed, very important for this market to grow. We have a robust wireless solution, which is the main point of being wireless, because you can be wireless, but to make it robust, it's difficult. And we already start integration phase, which is why we think we are in the first line to cooperate with the giant. Thank you.